Nicolette Gabel is Associate Professor, Division Director of Rehabilitation Psychology and Neuropsychology at the University of Michigan's Department of Physical Medicine and Rehabilitation. She specializes in cancer rehabilitation and provides neuropsychological assessment and intervention services to adults in both outpatient and inpatient settings. Today, Dr. Gabel will be addressing important concerns regarding chemo brain and what you can do to improve that pervasive post-treatment fog. Thank you, Dr. Gabel. I turn it over to you.
Hi, my name is Nicolette Gabel. I am a clinical neuropsychologist at the University of Michigan, and I'm here today to talk about cancer-related cognitive impairment, also known as chemo brain or brain fog, and more importantly, what strategies there may be for improving it. So I have an agenda here today. We'll kind of walk through this together, but we're going to start just by building a common language so that we're all kind of speaking the same language. There are going to be a lot of terms that you may be familiar with, but just to make sure that we're all on the same page to really help understand the research later and why the certain strategies are picked that we chose. In terms of chemo brain, the reason I'm using the hashtags there around it, the quote marks around it, is because there's actually some controversy about what might be going on there that's causing these changes for people. So we're going to talk about that controversy, what the research shows, and what we think some of those causes may be. Now that leads us into where the evidence base is for the treatments that currently exist. And then lastly, I'm going to kind of wrap up with some strategies that anyone can try to use to help with improving the quality of daily cognitive functioning. So the objectives here for this talk really are to just learn something new about how our brains work, to really get a better understanding of where the state of the research is on the causes of chemo brain or brain fog and what those evidence-based treatments might be, and then to adopt some new strategies for really managing cognitive problems that may be impacting daily life. So let's start out just by building a common language. What do these terms mean? Why is it important? So we're really going to be talking here about how the brain does what it does. It's a really complex thing that our brains do. What do we mean when we're talking about cognition? So let's start at the very base. We've got neurons. So here, this is your friendly neighborhood neuron. It's a cell in the brain. And it's kind of the one that we think of most often when we talk about brain cells. These cells have a cell body, which is that big kind of clumpy thing with the little tree branches hanging off it at the top. It also has a very long tail and then some little feet at the end. Now I'm using these colloquial terms, but they're all labeled here for you. So basically, this cell's whole purpose is to form connections to other neurons and other cells. That tail that leads from the body of the cell down to the end is insulated, a lot like an electrical cord. And that's because these cells communicate with each other with electricity. They are biochemical electric machines, and they signal each other using chemicals and then electrical impulses that then produce other chemicals. And that's kind of how one cell talks to another. There are a lot of other cells in the brain, though, too. So there's about maybe 1 billion neurons in our brains. There are 1 trillion of the other kinds of cells that are listed here. These cells include microglia, oligodendrocytes, astrocytes. Their functions are really to help support those neurons, either bringing them resources or cleaning up the junk that's no longer needed. They also are cells that can create that insulation around those neurons' tails to really help that signal go from one end to the other effectively. Now, if you zoom out a bit to the brain itself, the brain's actually divided into different lobes based on the functions and the cell types that are within those lobes. Those parts of the brain do different things. Our frontal lobes at the very front of the brain are really responsible for our movement and for helping us with problem solving. The temporal lobes, which are kind of inside where your ears are, around that area, really do help produce and understand the information received from the ears, sound, and also help us with producing language and understanding language. The occipital lobe, all the way at the back, is where we do all of our visual processing. So information from the eyes goes to the very back of the brain to help process that. Then you have this area that's sort of up near the back of the top of the head here. That's the parietal lobe. And what that part of the brain is doing is taking all the inputs from all the other areas of the brain, from all of the different senses that we use to understand our world and synthesizing all that information for us. So that's really a part of the brain that's necessary for reading. It's going to be processing language and vision and problem solving. It's also responsible for mathematical reasoning. At the very base of the brain, you have the cerebellum, which is responsible for balance and movement, but it's also responsible for helping to facilitate learning and some higher level problem solving, because it turns out, even though it's all the way at the back of the brain, it's communicating with the front of the brain. So very complex organs, but you can kind of break them down and understand them at these different levels. Now, underneath all of that sort of outer part of the brain, you actually have other smaller pieces of the brain that are doing other kinds of processes. One in particular that will be important for later is the hippocampus. That's where we're really getting our memory storage and organizing things in space. There's also the amygdala, the emotional center of the brain, and the way that we process things that make us feel afraid or angry. There's connections between different parts of these under parts of the brain, like the hypothalamus pituitary adrenal axis. Those connections between those different pieces of the brain help with our stress response system, which you may be familiar with from the idea of fight or flight. And then lastly, the big middle area of the brain there is the thalamus, and that's really a train station for different brain signals going from one area to the other. So really the connections between all of these things are what help us be effective when we're doing any kind of thinking or higher level problem solving or even basic emotional processing. Now, there's one other area that I think is important to know about when it comes to thinking about the brain and the brain structures, and that's the blood-brain barrier. Here, the blood-brain barrier is really protecting the brain from having things coming in through the blood vessels that don't belong in the brain. So it actually tends to keep out things that are toxic to the brain, although some small particles do get through, and we rely on that mechanism to be able to get medications into the brain that have to be there, things like antidepressants and sleep aids. This is also how drugs of abuse get into the brain, because there's small particles that get through that blood-brain barrier. So that'll be a little important later when we're talking more about the research aspect of cancer-related cognitive changes. Now I'm going to shift a little bit and talk about not just what the brain is and the different parts of the brain, but what the brain does. And what I mean when we're talking about cognition or cognitive functions. Cognition is basically the act of thinking. It might be the act of planning, the act of reasoning. It's those things that our brain is doing to help us understand the world and to be effective in the world. And I think about it in kind of a pyramid where you have to have the very basic functions working well at the bottom to have a good base. And then you build on that in terms of increasing complexity as you go from one cognitive function to the next. So really at the base, I think about attention as a very basic function. You have to be able to focus and pay attention to get information in, to be able to process that information. The next layer up would be, what do you do with that information once it gets in? Well, can you learn from it? Can you use it? Can you pull it back out later when you need it? Learning and memory. So that would be the next kind of layer that we're going to talk about. And then lastly, the highest layer of cognitive functioning is really that high level problem solving, prioritizing things to be effective, things like multitasking. We consider those executive functions, and those are kind of at the top because they're the most complicated. If we break it down further, when it comes to attention, what we really mean there is being free from distractions, being able to really concentrate and focus, maybe being able to switch from one thing to another effectively when you need to. Like if you're multitasking, being able to do one thing and then the other and kind of switch back and forth. It really involves being receptive to information, being open and able to learn, and then you can potentially retain that information for later. You also have to be able to kind of transition information when you're working with it. And you have to really, have a way of focusing to be able to do that. So you're going to transition what you're hearing maybe into something that you want to remember later. That's an attention function. When people are feeling like their attention is working well for them, they can really get into the flow of an activity that they're doing and feel very present. Now, if you think about the converse of this, when folks are having difficulty with attention, they may find that their attention gets hijacked very easily by things that are distracting, and it's really hard to focus and concentrate. It may be next to impossible to switch between two things at once or multitask. This is a big problem for a lot of the patients I work with, where you might start one thing and then you start doing another, you never get back to that first thing again. Without that attention ability, it really creates a problem with being receptive to new information. It's almost like it can't really get in. So there's no way to learn anything or to retain it for later. And it's really hard then to transition information into longer term storage that you can pull out later effectively. And for a lot of folks, they really don't end up feeling like they're present when they're engaged in an activity. They may not even remember doing the activity because their attention was elsewhere. So that's why attention, I think, is such a key component and the foundation of really any larger, more complex cognitive function. When it comes to memory and learning, there are a lot of different parts to the memory system. I'm going to focus today on the encoding part, being able to get the information in effectively and then pull it back out, because it turns out that this is really where the problem often shows up for people after they've been through cancer and cancer treatments. So I alluded to this a little bit in the last slide, but in order to be able to really take in information and kind of encode it into your brain so that you can pull it back out later, you have to be able to attend to it, whether it's audio, visual, or some meaning or fact that you're trying to retain. If you're not able to attend to it, then it's not going to get into your brain and you're not going to be able to pull it out later because it never got in the first place. To be able to do this, one of the main things our brain does is it has ways of actively rehearsing information and transitioning that information from something that you just heard into something that you can pull out later. So really being able to consolidate that information in your brain is a memory process. Sometimes it can help if there are things that you can associate a fact with or a name with. That association can sometimes help to move things from short term, I just heard it, into long term, oh, that was a week ago, but I remember it kind of storage. Now, it turns out that memory is actually consolidated during sleep. So if you're not sleeping well, it is extremely hard to learn and remember things later because that's when those processes are really happening for your brain to be able to take that information back out later on. Now, I alluded to how complex executive functions are. I'm putting this slide up in part just because visually, I think it represents well how complicated this is. And I don't expect anybody to read all of this or remember what it means, but basically, executive functions involve a lot of different processes that are high level thinking abilities. Things like being able to work with the information in your mind, being able to do mental mathematics is a form of working memory. Being able to be flexible with your thinking and flexible with your problem solving. If you know something's not working, being able to switch to a different tactic or find the solution. Those are all parts of executive functioning, as is being able to inhibit yourself from doing something very automatic. Like, let's say you're on your way home from work and you had meant to pick up a gallon of milk at the store, but now you're on the road and now you're on autopilot and you're not able to inhibit yourself from doing that thing that's so automatic for you. You get home and guess what? You never stopped for milk. So these are all different parts of a larger kind of combination of functions that we call executive functioning. And they really do rely on attention and the ability to learn and remember things to be able to be effective. So now that I've thrown a lot of terminology at everybody here, we're ready to kind of transition into what the research tells us. What is chemo brain? What is brain fog? What is going on? Now, the terminology that I'm going to be using very intentionally from here on out as we discuss this is cancer-related cognitive impairment. And you'll see why in a moment. So cancer-related cognitive impairment, just to define it for everybody, is a decline in cognition, all those thinking abilities we were talking about a minute ago, that seems to be associated with cancer and or treatment for cancer. It's generally characterized by self-reported cognitive changes. So usually it's a person telling their doctor, I feel like my brain is not functioning the way it used to, or maybe telling their family, or maybe their family notices. But generally speaking, it's something a person is aware of that has changed. It's usually noticed by most people who experience it during active treatment itself. And about a third of patients, and generally a lot of these studies were done on breast cancer patients, but about a third of breast cancer patients seem to have some actual objective cognitive changes when you are doing standardized testing with them while they're going through cancer treatment. Now, about a third of those folks might end up having some persisting symptoms after the treatment ends. But the typical trajectory that we expect to see is that those changes at that point after treatment ends, and maybe there's been a little bit of improvement, but most of the time people will stabilize at some point. They might even experience ongoing improvement over time in the months to years following the end of treatment. But generally, what we don't see is a progressive decline that just goes and goes and goes. If that's happening, usually there's some other factors going on that need to be addressed, because we don't expect after treatment ends for there to continue to be a decline after that point. So why is it controversial, and why am I using the term cancer-related cognitive impairment? Well, as it turns out, most of the chemotherapy drugs that are prescribed for non-brain related cancers, non-central nervous system cancers, don't cross the blood-brain barrier, or if they do, in very, very small amounts that are not easily detected in research. So the idea there, I mean, this is really an important one. We are using some really highly toxic medications to try to treat this disease, and we don't want it to cross that blood-brain barrier. So many of the ones that have been selected because they don't seem to. So that would start to lead people to wonder, well, if it's not crossing into the brain, then how is it impacting the brain so much? The other piece that's controversial here is that there's a difference between what people are reporting and noticing and what we're able to show in the studies where we're doing standardized testing. So there's a mismatch there. We're not able to really fully capture maybe what's going on. There does seem to be some subtle declines that we can pick up sometimes when we use our standardized testing, but there's a lot of variability from one study to the next in what areas are being impacted. Is it learning? Is it word finding? Is it problem solving? One study may say one thing, another's saying another. There's not a really well-defined kind of pattern at this point. And there might be differences from one study to the next in the level of severity of those changes that we can show with testing. So that has led to it being a little more controversial, a little less easy to kind of nail down. There's also some research more recently that has actually been able to demonstrate that there's a percentage of folks who have deficits on testing, changes in their ability to perform within normal limits on testing, that happens before treatment starts. So the treatment itself is probably not the only thing that's going on here. Some of the larger meta-analyses, which is like a study of studies, where they take all of the data and they sort of reanalyze it. When people are able to control for some of those before treatment cognitive performances, that has made the differences disappear between groups. One group that was exposed to chemotherapy and one group that wasn't. So again, it suggests that it's not just the treatment, there may be something else going on too that could explain some of these issues that folks have. But we do also have some pretty decent evidence on neuroimaging that do associate chemotherapy with changes in the brain. So these changes could include things like a reduction in brain volume, which suggests that there may be fewer cells in there than there were before. A reduction in white matter volume. White matter is actually the stuff that insulates those tails on the neurons. So that, again, it suggests there's some kind of breakdown happening there. There might be some abnormalities in that white matter, or it might not be as integrated or as consistent as it should be. Some of the integrity is gone. There does seem to be increasing evidence too that there are changes in neurons, in microglia, those little helper cells, and in the environment within the brain that seems to be associated with cancer treatment. Anzi has a very good review, Anzi and colleagues, from 2022 that this picture is taken from, just showing all the different potential mechanisms that might be at play here related to chemotherapy, other cancer treatments. There could be some direct effects from small amounts of treatments getting through that blood-brain barrier, but there's also probably a lot of indirect effects going on that could change how those support cells are able to do their jobs, how well information can be transmitted from cell to cell, et cetera. So I've started to allude to a lot of this, but there could be several causes going on here that could help to explain cancer-related cognitive impairment beyond just chemotherapy, although that is probably one piece of it. We are starting to get more and more information about genetics that may put some people at risk for having these cancer-related cognitive changes, some effects of not just chemotherapy, but other treatments that people go through. There can be a change in hormones depending on what your treatment plan looks like and what kind of cancer you're dealing with. Some chronic inflammatory effects, fatigue and sleep disturbance, changes in mood and emotional adjustment, and the general disruption that this causes in life and different factors associated with that. Now, what you may notice here is that many of the first pieces of this list are things that you may not be able to change, at least not at this point, in terms of, what you're coming in with your genetic makeup, or what kinds of treatments are going to be the ones that are going to effectively manage your disease. You might not have a lot of other options there. You may have to go with it. So, there are some things here that you might not necessarily be able to change, but there are a few here that we might be able to. And that will be what we talk about in a few minutes when we think about what are the treatments that are going to be the most helpful. But let's not get too far ahead of ourselves. We're going to break this down for a minute to really understand what might be going on. So we'll start with genetics. There have been some studies that suggest that there could be some risk profiles. In particular, one of the primary suspects is the APOE4 allele, which is probably known to some folks from studies in Alzheimer's, where this confers a greater risk of cognitive decline later on in life. Well, there's some suggestion here too that this might also put people at risk of having more of an impact to their cognitive functioning when they go through something as serious as a cancer and cancer-related treatments. There are a few other genetic profiles that could potentially also explain some of what's going on. Some research was specifically looking at genes associated with the blood-brain barrier, and that there might be some mutation that could confer an additional risk because suddenly now there might be more of a drug getting through that blood-brain barrier for some people. So this might explain some increased drug sensitivity, and that's something that I think will require some more research, but that's a plausible potential solution to the question of how does chemotherapy that doesn't cross the blood-brain barrier have an impact? Well, maybe for some people it does. Another genetic profile here is when looking at the COMT-Val plus versus COMT-MET kind of makeup. What that is looking at really is how neurotransmitters that are the cell signals from one cell to the next in the brain, how those may be impacted after a chemotherapy treatment or another cancer-related treatment. Turns out that for a subset of this kind of profile, there seemed to be worse attention scores, and that there was a genetic difference there that could be pointed to say, oh, that might be why. There might be more of an impact for people with this kind of genetic contribution going on. In terms of other treatment effects, I cannot tell you how many times I've spoken with someone about when they started noticing cognitive changes, and they'll tell me after surgery. So there is, I think, some growing evidence that there's, some cognitive risk for at least some folks from having to undergo surgery and being exposed to different anesthetics. This is one piece of the larger pie here. And for a lot of folks, when I do talk to them about this, there does tend to be an improvement over time. But this is one consideration when you're looking at all of the different things that people go through to manage cancer. There's multi-drug combinations and interactions as well that aren't necessarily fully understood at this point. So as you're layering more and more of these treatments on top of each other, it's possible and plausible that this could also be contributing to changes in the way that your brain's functioning. We know that there are some medications that you have to use for supportive care and to manage other symptoms that are coming from cancer and cancer treatments, such as steroids, that with long-term use can also have an impact on things like memory, executive functioning, the things that people notice when they're going through cancer and cancer-related treatments. Hormone changes are frequently experienced by folks as they're going through treatment for various kinds of cancers. So that here again, there may be some direct and indirect effects that could explain some changes in cognitive functioning. Being thrown into precipitous menopause or going through an androgen deprivation treatment could certainly impact the amount of estrogen that might be available for your brain. And it turns out that there's receptors for estrogen throughout your brain, and in particular in learning and memory structures. So this is another area that is, ripe for ongoing research to better understand what impact this could be having on cognitive functioning after cancer-related treatments. Chronic inflammatory effects are another area that is getting a lot of attention, not just in cancer-related cognitive impairment, but in a lot of other diseases as well. The idea here is that the immune system functions and adapts through the use of these proteins called cytokines. And cytokines help to really mediate how your body's responding to disease. So when you are dealing with the disease, you are going to have a change in your immune system, and that can have a systemic impact throughout your body and potentially also in your brain. So some areas that are currently a focus of research when it comes to the effects of chronic inflammation, chronic immune system activation, include cerebrovascular disease, cognitive decline even outside of cancer and cancer-related treatments, chronic pain disorders, and mood disorders like depression. The hypothesis here is that when you're going through something as serious as cancer and your body's responding to it and then, responding to the treatments that come with it, that creates this sort of biological cascade that could potentially change the way your cells are signaling to each other and how they're functioning. So the last items on the list of potential factors were really the ones where I think that I would consider them sort of low-hanging fruit, things that we know we have some effective management techniques for. So I'm going to go through those now, and then we're going to start talking about what you do about all of this. Fatigue and sleep disturbance, I probably don't have to tell anyone here, this is something that a lot of people are having to deal with. Cancer-related fatigue, as most folks know who have experienced it, is more severe and more persistent than just lacking sleep from not being able to sleep well at night. Somewhere between 30 to 40% of patients who are in remission, and cancer survivors in remission, report debilitating fatigue that has an impact on their quality of life. And somewhere between a quarter and a third of folks have long-term fatigue that they're dealing with for a very long time afterwards. Sleep disturbance itself, though, not being able to sleep through the night, there's a wide range in the research literature of how many folks are impacted by this. But my guess would be a lot. This can have an impact both before, during, and after treatment. And somewhere around 19% of folks after their treatment are still meeting criteria for insomnia. This is associated with lower quality of life and with cognitive problems and with depressed mood. And that is actually very consistent even outside of the world of cancer and cancer-related treatment research. So we know that this is another potential area that is likely to have a significant impact on cognitive functioning. When it comes to mood symptoms, distress is extremely common after receiving a diagnosis of cancer, and it's the most kind of prevalent right before treatment starts. There was a very large scale study in Sweden that had about 300,000 patients in it. And they were able to look in the years leading up to a cancer diagnosis and the several years after at whether or not there was also then a diagnosis of depression or anxiety, substance abuse, stress reactions, mental health concerns for folks. And what they found, not surprisingly, is that in the months leading up to diagnosis, likely when symptoms are starting to be noticeable and there's more and more evaluations to try to figure out what's going on, there's a significant increase in the prevalence of these different disorders kind of creeping in. And then at the time of diagnosis, these folks are at 10 times the risk of the general population of experiencing depression, anxiety, stress reaction. That risk of mental health symptoms starts to reduce slowly over time, but it still takes quite a while to get them back to the point of being at the same risk as the general population. So here again, this is a big factor that has a huge impact on people in terms of their quality of life. It can also have an impact on their cognitive functioning, even without cancer and cancer-related treatments. This puts a lot of additional strain on brain functioning. It takes up a lot of bandwidth, is what I tell folks I'm working with. When you are chronically experiencing anxiety, depression, and stress, it's like you're giving all your energy to having to manage that. There's a lot less left over for being able to just pay attention and be able to take in information and be effective with your problem solving and your multitasking. So the folks who are most at risk from these large scale studies, as far as we can tell, tend to be women, people who are younger at the time of diagnosis, folks who have a diagnosis with a poorer prognosis, or the diagnosis comes when the cancer is already at an advanced stage, or when there's invasive treatments involved. That really does increase that risk of distress. So what on earth do we do about it all? Well, as I alluded to before, there are a couple of low-hanging fruit areas where we have some really good evidence-based treatments that seem to make a difference. So to start with, when it comes to fatigue, there's growing evidence that certain exercise programs that are specific to managing fatigue seem to be effective. When you combine that with a cognitive behavioral therapy for fatigue, there's very strong evidence that there can be a positive impact there and a reduction in fatigue. There's some preliminary evidence as well for things like psychostimulants. Those are like medications that you would give for, primarily they're used for attention deficit disorder types of symptoms. So that's something that's a growing kind of area of research and investigation at this time. And it's something that you may see happen often is, consideration with your doctor whether or not a psychostimulant could be helpful. With sleep disturbance and insomnia, I will often tell folks to consider getting a sleep study if it hasn't already been done, because there might be a few different things going on there that could be addressed. One major area that we get concerned about when it comes to cognitive functioning is obstructive sleep apnea. If sleep apnea is going on and it's not being actively treated, that alone can have an impact on things like memory and executive functioning and how fast you process information. So we want to get that off the table if that's going on. There's some very strong evidence for cognitive behavioral therapy specifically for insomnia. It's one of the most effective treatments out there that's behavioral in nature for a problem like this, and it's more effective than medications are. So anytime I'm working with somebody and we're identifying that sleep disruption is going on and they're having cognitive issues, CBT for insomnia is usually my go-to once we've identified that there's a problem there that could be addressed with this kind of treatment. In terms of treatments for mood symptoms, there's good evidence for psychotherapy, including cognitive behavioral therapy, and a growing evidence base for a newer version of therapy called acceptance and commitment therapy, which is very much like CBT, but with a focus on values and developing meaning and using mindfulness strategies. There's also been a specific treatment for folks with cancer-related cognitive impairments called mindfulness-based stress reduction. That's really focusing on not just mindfulness, but also different meditative practices and body practices to help reduce distress and kind of recalibrate the ability to focus and pay attention and feel present. Antidepressants, generally speaking, there has not been a large-scale study looking at antidepressants for mood symptoms specific to cancer. But we usually will recommend that you go based on what the individual and general efficacy looks like. So working with your doctor one-on-one on what kinds of medications may be most helpful for managing mood symptoms in this context. But what specifically can we do about cancer-related cognitive impairments? So here are the evidence-based treatments we have so far. Exercise has growing evidence that it seems to have an impact, particularly with memory and executive functioning. And when we're talking about exercise here, the ones that are really winning out in the studies tend to be the high intensity interval training and moderately intense exercises. There's a lot of animal studies that have been done that do suggest that the hippocampus, which is the area of the brain where memory processing happens, seems to really benefit from that high intensity or moderate intensity exercise. So we think maybe that could be helpful here too. If we need to grow some more cells in there after going through cancer and cancer-related treatments, this might be one way to do it. In terms of medications, specifically for cancer-related cognitive impairments, there's currently no established standard of care. There have been a lot of studies done, but in general, it's been a bit piecemeal in terms of which medications are being used, what the outcomes are that we're looking for. In clinical practice, it's not uncommon for there to be a prescription for a psychostimulant if there are attention-based issues going on, because in general, those are kind of the go-to if attention is the issue. There's some growing research being done on anti-dementia drugs. Memantine is one, but there are many of them. And initially, what we know is that it seems like there might be some neuroprotective effect for these drugs if a patient has brain cancer, but there's not really a whole lot of information out there about folks who don't have brain cancer but have other cancers and seem to have some cognitive changes that are related to that. We just don't know if that's actually going to be an effective medication for a person in that situation. And as I was mentioning earlier, mindful-based stress reduction is one treatment that has growing evidence that it seems to really help with attentional control. So we think this might be helpful when you're going through cancer-related cognitive impairment. What I do in clinical practice as a neuropsychologist is I start with an evaluation so that I can get a really good sense of what's going on for the person in front of me. This allows us to really determine what is the severity and what are the specific cognitive problems, because As I mentioned earlier, a lot of the large scale studies, you end up having a washout effect because different people seem to have different issues going on to some extent. So here I want to get the person one-on-one, figuring out what is going on for them cognitively. We can then identify some modifiable factors, whether it be sleep disturbance or mood symptoms, or maybe there's something else going on in their environment or in their lifestyle that we could make a change that could have an impact. So we identify those factors that we could potentially address to improve cognitive function. From that, we then develop an individualized treatment plan that involves recommendations. And we track over time and looking for change there, hopefully change for the better, but at least having some additional opportunities to add in new recommendations, or if the situation has changed, really identify what's going to be helpful at that point. Often what comes from that as well is a recommendation specifically for an individual cognitive rehabilitation therapy. There are two types of folks I will most often refer my patients to. One is speech language pathologists. They're often what they're going to be doing is covering strategies for improving daily cognitive performance. They might be looking at communication techniques and skills. And they really do a lot in terms of looking at how to improve verbal fluency, which is kind of like word finding, being able to express yourself easily. A lot of folks who have gone through cancer will notice a change in that ability level. They provide in-session training and homework, and that homework is to practice in between sessions. And then they check in on a regular basis and maybe give you some more strategies, some more homework. Occupational therapy, very similarly, is looking for strategies to really optimize your daily activities. Now, they may be looking at those activities that are involved in, doing things around the house. If you're going to school, what kinds of activities are going on there or at work? They're going to provide training for using very specific tools to improve those daily functions as well. There's another cognitive rehabilitation treatment that's my go-to in terms of having an intervention that's very specific and targeted to cancer-related cognitive impairment. And that's memory and attention adaptation training. And that's by Ferguson and Gillick, and they published their manual recently. It's actually available on Amazon. I don't receive any benefits or anything like that. I just think it's a really great program. And it's basically a manualized cognitive rehabilitation treatment that incorporates cognitive behavioral therapy. So when I'm working with patients, we're doing something along the lines of a memory and attention adaptation training like this. You're really starting out by identifying what are the triggers for the cognitive problems? Where are they happening? What's going on at that time? That really gives you some clues. You can start to develop some compensatory strategies for managing them. It also involves really enhancing self-awareness, being able to understand what's happening and being able to know when is this strategy going to be most effective. A big component here too is identifying new ways to manage stress, because I don't have to tell anybody here, if you're having cognitive changes after having been through cancer and cancer-related treatments, it's very frustrating. And there might be a lot of other things going on that you're having to adjust to as well. And as we mentioned earlier, when your brain's dealing with stress and a lot of emotional stuff happening, the bandwidth is very much reduced for the higher level cognitive functions. So we want to be able to manage that stress as effectively as we can. We do that through education, being able to understand and reattribute what's going on and reduce distress. There are cognitive rehabilitation groups that have been developed as well. These interventions, typically in a similar way, are using education, strategies, and homework in between sessions to really refine your ability to manage cognitive changes. A few of them are listed here. Emerging from the Haze is one program. Intensive mindfulness training has some research behind it, and memory and attention adaptation training has been done in group formats as well. So in terms of like, what can I do today? What can I do for myself? What can my family help me do? There are several strategies that I recommend. Some of these may seem obvious, but I do think that they are really a way to go to help you get a sense of having control, having something you can do that can have an impact right now. So first and foremost, I think it's really important to think about what are the important goals and to set those goals and define how you're going to track them over time. This is a way of maybe forcing some executive functioning back into the picture. You want to be a scientist or an expert of yourself. You really want to get down to what specific problems am I having here? When are these problems better? When are they worse? What might be going on that could be contributing at any given time to a particular problem that I'm having? What are the circumstances around, not just in the environment, but internally? What am I feeling when I'm going through this? What are the things that are triggering this? Are there situational factors as well that make it more or less likely that a cognitive problem is going to occur? Once you have that kind of laid out, you can think about what specific goals are meaningful and achievable for you. So, one thing that you may think off the bat is I want to reduce the amount of times I'm having memory lapses and then getting frustrated about it. Okay, that's a good place to start. But now let's get it even more specific. Maybe I want to start with something I know is achievable potentially. I want to know where my keys are before I try to leave the house. So that's going to be something that will help me to, reduce the frequency of a memory lapse in a very specific way. And I can track whether or not I'm achieving that over time. How many times this week did I leave the house and I knew exactly where my keys were? You might have other home-based goals or work-based goals. Maybe I want to reduce my distress around getting this project done or getting my house cleaned or whatever it may be. But the key here is to really lay it out so that it's specific. You know when you've actually achieved it, and then think about how you're going to hold yourself accountable to that. Often tracking is one way to make sure that there's accountability. Maybe it's writing things down, maybe it's recording it in your phone, maybe it's telling your friend or your spouse or your child that you're going to be doing this thing and then checking in with them on a regular basis about how it's going. If you're noticing specific attention problems happening, there are some strategies that can be very effective for folks. One is to be very mindful of the distractions that come up when you're trying to do something in a focused way. Really avoiding multitasking to the extent that you can, just trying to have the one thing that you're doing until it's done and then move on to the next. There may be time holes where you're finding yourself just kind of involved in a task so long that you miss some other thing you meant to do. And that suggests that maybe setting a limit, maybe having an alarm go off when it's time to move on to something else could be helpful. For a lot of us, this might look like getting lost on social media for an hour when you only intended to check on your email or something like that. Really kind of experimenting with setting a limit there might be helpful to free up your attention and make it less likely that you're distracted. I often recommend creating a quiet space in the house, low clutter, nothing else going on, where you go specifically to do complicated things that might require your focus or your concentration, whether that be, consolidating your checkbook, paying your bills, looking at your treatment plans, reading through your medical records. So things that are important to you that need to get done should really have a space that they can be done in that sets you up for success. I also recommend thinking about how your energy level is throughout the day. Are there times of day where you feel more alert? For a lot of us, mid-morning is probably the best time to be doing really complicated mental tasks. After lunch, not so much. That's usually when people want to take a nap. So you're thinking about kind of the rhythm of your day, the rhythm of your energy, and then being mindful about what tasks you're going to do at those times so that you're setting yourself up for success. The mindless stuff, I recommend after lunch. If you're involved in a task for a while, you do want to build in some breaks. The idea here is you don't want to push yourself all the way to the point where you can't focus anymore. You want to give yourself a little bit of a break to recharge your focus before you've completely ended the ability to stay concentrating on a task. Here, I'll recommend, let's say if you're normally working for about an hour and you're finding yourself losing your focus, maybe cut out 5 minutes before then and take a break. Walk outside, take some deep breaths. Deep breathing and mindfulness have some growing evidence in terms of the meditation literature that there does seem to be an impact on attention. So here you can throw in a couple of nice, slow, deep breaths that you're really monitoring as you're doing it as part of your break to recharge that attention. Meditative practices in general are something I recommend folks investigate if they aren't already doing it, maybe just once a day for a few minutes at a time, having an ability to clear your thoughts out and really refocus. For memory problems specifically, there are a few strategies that I'll frequently recommend. One is to create an external brain. You want to keep some kind of notebook or use some kind of technology to alert you, to remind you. That helps to relieve that extra burden of having to remember that you meant to do something later, which we call prospective memory, like memory for the future. If you can set that up so it's an alarm and it's not something that's constantly on your mind, all the better. I recommend one notebook if you're going to take notes rather than having sticky notes all over the place. That way you always know where you need to look for it. You try to keep it with you wherever you're going so that you can always find the information when you need it, and you don't have to feel like you need to carry that extra burden in your mind. In the home, I recommend that everything you use regularly has a designated space and that you get into a real routine and habit of always keeping those items in that place. For me, I always keep my keys in my right pocket and my phone in my left pocket. I always know that's where they are. If they're not there, something must have happened to throw me off. In the home, you might want to have a landing pad for your phone, for your keys, for your purse, for your medications, for the things that you use most often that you do not want to have to spend your time and your energy searching for, because that tends to be when people get really frustrated and upset too. You may want to maintain a calendar that's in a visible area of your home. I often recommend either the hallway that you walk down all the time or the refrigerator if you go to the kitchen often, so that you have these visual reminders as well. And again, you're not having to keep it all in your brain. When you're pursuing a lot of different goals, maybe even having a visual chart that you can see to really help put it outside of your brain onto something else so that you're not trying to carry it with you. Rehearsal and repetition tends to be really helpful for most folks who are trying to improve their memory and their learning abilities. When you're involved in a conversation and there's a lot of details going around, finding a way to ask again about those details allows you for an extra repetition, and it makes the person that you're talking to really know that you're actively listening. Sometimes folks will say that they're having a really hard time remembering names, and there we will often recommend creating some kind of association with a name or with some tasks that you're going to do later. Almost like when you tie a string around your finger, you're associating that cue with some task that you're going to do later. That does seem to help in terms of being able to store the information more easily, because then you have more clues to pick it back out again. And then lastly, when it comes to being able to recall conversations that you just had, it's really helpful if you are very intentional about being mindfully present, really stopping anything else you're doing, looking the other person in the eye, really focusing on listening so that you're sure to get the information in the first place so that you can store it and then pull it out later. That's often the barrier to being able to remember something like a conversation. And the last more general recommendation that I will make for folks is that I think people in general are a little too hard on themselves. I think we hold ourselves to very high standards, and it's much easier for us to provide support to friends or family or other people we know than it is for us to support ourselves. When it comes to these very frustrating changes that can happen with cancer-related cognitive impairment, I will often recommend something like the Serenity Prayer for those who are familiar with it. This idea that you want to be able to cultivate the feeling of being able to accept things that you can't change, that you don't have control over. There's probably a lot of them, probably more than we think in everyday life. But we do also want to be courageous about making changes where we can. Being able to identify what those things are that we can change is sometimes the hardest part. So really developing the awareness and the wisdom to know the difference between something you can change and something you can't, and being as kind to yourself in that process as you can. So really, those are kind of the main strategies that I recommend regularly for folks who have been through cancer and treatment or noticing cognitive changes. I will say that this is an area that's continuing to evolve in terms of ongoing research, and we're doing our darndest to understand this really complex kind of system that's being affected when we're seeing cancer and cancer-related cognitive impairment. So, 5 years from now, this talk may be completely different, but I think some of these strategies, no matter what we find, are going to be helpful. And that is my hope for anybody listening here, that it could be helpful to. And with that, thank you very much for your attention.